Hello dear students, welcome back to my channel. I love pharmacology. In today's session, let us see which are the CNS drugs that needs to be avoided in elderly people. So you need to avoid sedative, hypnotic, anti-anxiety drugs like chlordiazepoxide, diazepam, barbiturates, clorazepate, flurazepam. So I'll repeat it again. So these are the sedative hypnotic agents which has got anti-anxiety property that needs to be avoided in elderly people are chlordiazepoxide, diazepam, barbiturates, clorazepate, and flurazepam. So what is the reason for avoiding these drugs in elderly people? So the reason being, basically, these drugs will prolong the off-life, whereby it increases the duration of action as well as it can lead to toxic, harmful effects. So, this prolongation in the half-life of the drug is mainly related to age-related decline in the kidney or the renal function as well as the decline in the hepatic function. And moreover, these elderly peoples are highly sensitive to this sedative, hypnotics, and anti-anxiety drugs. So what happens if these drugs are given? The patient may prone for ataxia. There may be loss of postural reflex. There can be fall, which can lead to fractures and injuries. So basically, the reason for prolongation or the action of drug will be there for longer time due to the decline in the kidney as well as the hepatic function, which is age related in nature. So next, moving on to the drugs which can be given in these patient as a alternative drugs. So which are the safer alternative drugs in such patients? So the safer alternative drugs are oxazepam, lorazepam, alprazolam, temazepam. So the drugs which are safer as sedative, hypnotic, and anti-anxiety drugs in elderly people are oxazepam, lorazepam, alprazolam, temazepam. So what is the reason? So the reason is these drugs, they do not have active metabolites. They do not have active metabolites. Thereby, the duration of action will be shorter. So they have got shorter half-life and they are less sedating compared to the other drugs we saw in the previous slide. So this was about the class on the CNS drugs that needs to be avoided in elderly people. So we saw which are the sedative, hypnotic, and anti-anxiety drugs that needs to be avoided, and what is the reason for avoiding these drugs in elderly population. And also we saw the alternative options available as a sedative, hypnotic, and anti-anxiety drugs in case of elderly people. Thank you. If you find this video useful, please do subscribe to my channel. I love pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.